Hello and welcome to our part 3 of our condition-specific webinar. The first week we talked about acne, then last webinar we talked about aging skin, and today it's going to be all about treating sensitive skin with confidence. I'm Danielle Rosil with ClarityRx and looking forward to jumping in and diving deep into sensitive skin and how to treat it using our products. So sensitive skin is one of those conditions that we have our clients, telling us on a regular basis. So pulling up some data and research, it's actually, if you poll individuals, there was 60 to 70% of women and 50 to 60% of men report having some degree of sensitive skin. I'm sure you guys can't go a day in the treatment room without hearing multiple times, I have sensitive skin whenever you ask your clients to describe their skin. Now, there is a difference between sensitive skin conditions and then sensitized skin. Good news is with sensitized skin, there's a lot of things that we can do to actually repair and rebuild the skin. So it's no longer sensitized. And then sensitive skin, there are still many, many treatment options, both at home with home care, as well as professional treatments that we can offer our clients so that way they don't have to experience the symptoms and persistent redness that is correlated with sensitive skin. Now, the definition of sensitive skin is a heightened intolerance to topical products or external factors. So it's a very simple, oversimplified definition for sensitive skin. But let's take a deeper dive into what's actually going on in the skin in order for it to actually be sensitive and considered a sensitive skin type or sensitive skin condition, because those are two different things. So underneath the skin, and I'm sorry, starting on the surface of the skin, most important here, because that's what people actually are noticing, and that is kind of the end result of things that are going on below the surface. So above the surface, in your sensitive skin conditions, you have an abnormally functioning stratum corneum. Now, this is our skin's first line of defense and barrier. So if we have an abnormally functioning stratum corneum, then we are going to notice an increase in transepidermal water loss. And then there's also going to be a disruption in a lipid bilayer. Now, if we have an increase in that transepidermal water loss and our lipid bilayer that is not functioning properly, then it's not able to protect our skin from any sort of environmental stressors, damage, and anything that you're putting on the skin, especially if that lipid bilayer is disrupted, it's going to cause some stinging. And then you're also going to have some redness and pinkness to the skin. Now you also can see a surface texture change. So there is a buildup of dead skin cells on the outer surface. And this is where you're going to see and feel more of that dry, flaky skin. So oftentimes people with sensitive skin, they feel like their skin can't tolerate any sort of exfoliation. And there are definitely certain types of exfoliation that we want to avoid, but there are things that we can do to ensure that that cell turnover is staying in that normal 28-day cycle. Now, below the surface, what we see is an increase in vascularity. So that's going to be that redness and that increase in blood flow that now you're ultimately going to see on the surface of the skin. You'll also see and experience some hyperpermeable and dilated capillaries. So what happens is when those capillaries are dilated and over-dilated, you're going to see that increase in blood flow and that redness within the skin. But then there's also a component to where those capillary walls, they become weak and broken down, and you have that inner fluid that's inside the capillaries start to leak out into the surrounding tissue. Now, the surrounding tissue is not used to having this sort of fluid out and around it, so that's going to trigger an inflammatory response and for your skin to kind of go into high repair mode. So with what we want to do when we're treating the skin is not only helping to decrease that redness, keep that cell turnover up, but we want to strengthen those capillaries, and we want to make sure that, our inflammatory response within our skin is natural and it is protective, and we want to make sure that that stays intact. But the problem when it comes to sensitive skin is that that inflammatory response never quite turns off. So if you're looking at it or thinking it more of like a light switch, when there's inflammation or trauma, that light switch is flipped on, and that inflammatory response kicks our body and our skin into high gear to go and to repair itself. Now, increasing that blood flow, that's all part of the inflammatory response. The problem therein lies is when that light switch is constantly turned on and constantly inflamed, and there's never really that off switch. So by incorporating the products, and we're looking at, services that we're doing in the treatment room, or retail products that we are having our clients go home using, what those products should be designed to do is to help that light switch to turn off so it's not constantly in repair or inflammatory state. We do want to say, so just to kind of follow up, that exfoliation is important, and that's one thing that we shy away from, and clients tend to shy away from, and as estheticians, if we're not super comfortable, we are afraid to exfoliate sensitive skin. Now, it's important to determine, the difference between your impaired barrier function and all of that versus just sensitive skin. So you're sensitized versus sensitive skin. Now, when it comes to sensitive skin, we want to increase that exfoliation because that way we're smoothing out that dry, flaky texture on the top. But now anything that we're applying on the skin, whether it's vitamins and nutrients and nourishing and hydrating ingredients, it's now able to penetrate into the skin a little bit deeper where it needs to be in order to make that improvement. And it's not just sitting in the surface of that dead skin cell buildup. Our ultimate goal and main purpose for treating sensitive and sensitized skin is to decrease that redness, help to reduce the inflammation, and repair the skin's barrier function. When we do this, then you will lead to healthier, stronger skin, less red skin, and they'll be able to tolerate a lot more, and your clients will be a lot happier. Now, under the category of sensitive skin, there are 4 different conditions. So you have your impaired barrier function, then you have your rosacea, then atopic dermatitis or eczema, and psoriasis. So we're going to touch a little bit more on impaired barrier function and rosacea this morning. So for your impaired barrier function, that's where that disruption is happening within that lipid layer of the skin. So that natural moisturizing factor that we have within our skin is no longer functioning the way it should. And what's going to happen is that you're going to have an increase in water loss. So you can see here on the image on the left, you have kind of that rough surface texture, but any sort of hydration or natural moisturizing factor that's happening within your extracellular matrix is coming out the surface of the skin. Ultimately, what we want to do is treat that lipid bilayer and help to restore the balance so that way it's able to keep that hydration and that water balance within our skin. Rosacea. So there are 4 different types of rosacea. So we have subtype 1, which is the erythema telangiectatic rosacea, and that's going to be your first picture on the upper left-hand corner. Then you have subtype 2, which is your papular-pustular rosacea. Now, this is one subtype of rosacea that we want to make sure that we are able to differentiate between papular-pustular rosacea and acne, because we don't want to treat subtype 2 rosacea the same way that we treat acne, because we don't want to exacerbate the skin condition. And the tall tale sign of whether it's subtype 2 rosacea or acne, oftentimes, as you can see in the picture on the top right hand corner, is the inflammation within the tissue and the skin is not just surrounding the acne lesion. When you look at true acne skin, and this is going to be more of your grades 1 and 2 acne, because you're seeing those papules and there's pustules. You're not necessarily seeing, cysts and nodules when you're looking at subtype 2 rosacea. So within subtype 2 rosacea, that inflammation and redness is not just targeted to around the acne lesion, but you will see redness around the entire surrounding tissue. Now, with rosacea specifically, it tends to affect the central third of the face. So that's another indicator if you're seeing some papules and pustules and bumps within the skin and extra inflammation in the surrounding tissue, not just around the lesions, that might be a good indication that they are experiencing subtype 2 rosacea versus acne. Then you have subtype 3 rosacea, which is phimosis rosacea. So this is the thickening and the enlargement of the nose area. Then subtype 4 is ocular rosacea. So for ocular rosacea, your clients are typically already diagnosed with another subtype of rosacea, and ocular rosacea is a secondary subtype of rosacea. This is one that, of course, as estheticians, we're not able to diagnose. So definitely make sure that we're falling within our scope of practice of not diagnosing a skin condition such as rosacea. But it's important for us to recognize the signs and symptoms of rosacea so we can make sure that we're treating them properly within our treatment room and also recommending them to a dermatologist if they have not been already diagnosed with rosacea. All right, so now comes into play the ClarityRx products that are going to be designed to help to treat sensitive skin conditions. So our products and going back to determining, the subtype 2 rosacea versus acne rosacea, our products, they're very, very versatile and gentle. So as a reminder, when you're treating sensitive skin, we want to make sure that we are still avoiding, this is all skin conditions, but especially with sensitive skin, we're avoiding any, synthetic dyes, synthetic fragrances. We want to have a clean product line. And with ClarityRx, our products are free of all synthetic dyes, all synthetic fragrances. We do not have any fillers. We do not have any harsh chemicals that are utilized in our products. So it makes a perfect selection when it comes to treating your sensitive skin clients. So the first step in any skincare regimen is going to be an appropriate cleanser. So Cleanse Daily is a very rich and nourishing foaming cleanser. So in the Cleanse Daily, you're going to infuse the skin with some skin strengthening vitamins. One of the big things is there's olive oil within this cleanser. So olive oil is very rich in vitamins A, D, E, and K. So it's going to have a natural moisturizing factor to it. And then also has seaweed in there. So seaweed is going to be a very strong humectant that is also rich in vitamin E. So it's helping to strengthen and repair the skin's barrier while also being able to cleanse away any sort of dirt, impurities, and environmental things that can trap into the skin. So it's a very gentle cleansing option for anybody with sensitive skin. And this is appropriate to be used morning and night. Now, a trick with our cleanser, especially with Cleanse Daily, is because we don't have any surfactants in here, it's not a very strong foaming cleanser. So what you'll want to do is you'll want to instruct your clients, and same with you if you're using it in the treatment room for your professional treatments, you'll put a pump of the cleanser in the palm of your hand, add a little bit of water, and rub the palm of your hands together to create a nice foaming lather. Now, if you're not getting a strong lather, apply a little bit more water, not necessarily more cleanser to the skin. Exfoliation. So our Get Clean Crushed Bamboo Exfoliator is a very gentle physical exfoliant. Now, as long as somebody doesn't have a very strong, intense impaired barrier function, you can absolutely use this product in a very, very gentle manner. So if somebody has severely inflamed rosacea, we wouldn't want to use this product, but if they have just a very mild sense of rosacea, what you can use is the Get Clean to have a light exfoliation. Just please stress to your clients the importance of not having a lot of pressure when they're doing circular motions with the Get Clean because of that bamboo in there. Now, the reason why we say that this is okay, it's got a lot of rich, nourishing factors to it in the Get Clean. But in addition to the crushed bamboo, there's also there's also fruit-derived enzymes in there. So it does contain some bromelain and papain. So those enzymes are going to be able to gently digest the desmosomes. So those are the glue that's holding the dead skin cells together to be able to increase that cell turnover. But it also has some cucumber extract, which is very, very calming. It's high in antioxidants, which is important for all skin types and skin conditions. Same with rosemary extract. So rosemary extract is going to help to protect the skin from inflammation while also calming and reducing any sort of puffiness in the skin. This would be something, especially for sensitive skin, I would advise using it once a week to start with. See how their skin tolerates it, and then you can gradually increase that frequency as their skin is becoming repaired and are strengthening throughout your treatment process. All right, serum. So take it easy. This is one of the most important serums that I would say if any client that is coming to see you that has any sort of persistent redness, sensitive skin condition, you want to send them home with Take It Easy. So Take It Easy is going to be used, so it's a serum-based consistency. There is hyaluronic acid in there to help to draw in moisture and bind it to the skin. But the two main anti-redness ingredients in here, and as you'll see, during our studies, we saw 32% improvement in redness and inflammation in the skin after just 2 weeks of use. So you're able to see a huge improvement in the skin when incorporating this into your sensitive skin client's daily care regimen. Now, the two active ingredients I want to highlight here is the Chrysanthemum indicum. Now, this is another word for it is going to be your golden chamomile. So the golden chamomile, just like other chamomile, is very, very calming and soothing to the skin, but the golden chamomile actually has an even stronger anti-redness effect than the traditional chamomile. And that's due to the mix of soothing compounds within this type of chamomile in itself. So it's great for your extra sensitive red skin. The other ingredient here is going to be your saccharide isomerate. So this is going to be a plant-derived carbohydrate that will actually mimic the carbohydrate that's naturally within our stratum corneum. So it's all about restoring and repairing that barrier function, so that way our skin is able to protect itself. This ingredient in particular is great at reducing itchiness within the skin. It's going to be great at helping to repair any sort of dryness. And what it does is it actually binds to the keratin within our keratinocytes. So as long as we are using this, so you can use this morning and evening. If somebody, doesn't need it twice a day, then please, by all means, or maybe simplicity is a little bit better for them as far as following a daily care regimen. You may use it once a day, so either AM or PM, but initially starting off with this product, we would recommend using it morning and night for ultimate skin to be able to reduce that redness and repair the inflammation within the skin. But because these ingredients will actually bind to the keratin, it's going to remain on the surface of the skin until you're exfoliating it off. So the results within this product is going to be cumulative. I think the biggest thing here, especially with sensitive skin and redness skin is ensuring that our clients are patient. So their skin didn't get to this state and this condition overnight. It is going to be a process to be able to help to repair their skin. So consistency is very, very important, but also patience is important when treating sensitive skin. Next up is It's Becoming. So It's Becoming is an anti-aging concealing moisturizer. So one of the biggest complaints with sensitive skin, especially if it's just they're experiencing more of that persistent redness, is not being able to conceal that redness. So It's Becoming has an adaptive color to it. So you'll notice when you put a pump or two on your hand, you'll want to break open. So it's got some beads in there. So you'll want to break open those beads and let it sit for a second and allow it a few minutes to adapt to the color of your skin. But what's going to happen is this color is going to help to mute any sort of redness within the skin. Now, because it has that color associated with it, we sought this for morning use only, and you can use this prior to applying your Ultra Skin Defense sunscreen. So after cleansing the face, you can apply the Take It Easy serum. Then you'll apply 1 to 2 pumps of It's Becoming to the face and neck. This is also anti-aging, but that jojoba seed oil is going to provide that necessary lipid ingredients into the skin, which is naturally disrupted in sensitive skin. Next is On the Mend. So On the Mend has Arnica montana in there. So Arnica montana is very, very healing to the skin. And that's ultimately what we want to do is reduce the redness and heal the skin. In addition, you have your calendulum extract, which is anti-inflammatory as well. This has more of so upon application, you'll feel a instant cooling and soothing sensation. So that cooling and soothing sensation is going to work to help to reduce any sort of redness within the skin. And then with that calendula, it's antibacterial and antifungal. So if you have any sort of, surface bacteria on there, it's going to help to treat the skin. And then last but not least, aloe vera leaf juice. So we know how powerful calming, after a sunburn, aloe is great to it because it's rich with vitamins A and vitamin C, which are all natural anti-inflammatory components to it. And then the St. John's wort is going to help to speed up that healing process. So between the combination of the Arnica montana and St. John's wort, you're ultimately helping to stimulate and speed up the healing within the skin. All right, a favorite within our line, especially when it comes to an impaired barrier function, is Nourish Your Skin. So Nourish Your Skin is our 100% squalane oil. So squalane oil is actually found naturally within our lipid bilayer of our skin. And as you remember earlier on this morning and today, we had talked about how that lipid barrier function is disrupted. So we want to make sure that not only are we adding in hydration components like your hyaluronic acid to restore and replace that transepidermal water loss that's happening, but we need to be able to lock that hydration and that moisture in with an oil and Nourish Your Skin with it being it's a very, very simple product. So 100% squalane. It is a perfect option to be able to add into anybody's skin regimen that is experiencing an impaired barrier function, dry, flaky surface, because it's going to help to seal in that hydration within your skin. So you can use this morning and night. You can also add it to a moisturizer if you choose, or if somebody, they're not quite used to utilizing an oil within their daily regimen, that may be a great way to slowly incorporate, but being able to get that squalane oil into their daily regimen. Next we have is Healing Fine. So Healing Fine is going to be a petrolatum barrier ointment. So if you have somebody who is severely, and that barrier function is severely impaired, these are the people that, sometimes just even water will sting their skin. This is a great option to have on hand. So great for post treatment, soothing the skin. One of the big things here, so it is a petrolatum base. It also has vitamin E and vitamin A. So the vitamin A within this product is going to be derived from algae. And the reason why it is in this product is to help with that restorative and reparative properties in there. So this would be something that you would use morning and or evening and on an as needed basis. All right, as far as masks go, cold compress is a wonderful mask option for anybody with sensitive skin conditions. So you have your soothing cucumber. It's very, very hydrating to the skin, especially for redness. If you have those clients, a lot of times if they have persistent redness or severely red skin, their skin almost feels warm to the touch. So with cold compress, it's going to help to cool and soothe the skin. For at-home use, this is a wonderful product to actually keep in the refrigerator for your sensitive skin. This does have chamomile in there, which is going to help to soothe that stressed skin. It also has a little bit of antiseptic properties to it, and then that cucumber extract. So contains high concentrations of antioxidants. It's going to protect the skin. It also is a very, very powerful calming and soothing ingredient in here. If you have somebody who is severely impaired, a little trick of the trade is you can actually apply a drop or two, and this is going to be at home. You can apply a drop or two of Nourish Your Skin first on their full face, and then follow up with the application of the cold compress. That will provide just an additional oil lipid barrier in there to add that extra calming solution for highly compromised skin. All right, so treating the sensitive skin within the treatment room. So we have a couple different options available. So Infuse It. This is such a versatile mask. So it is our pop-up mask. Now the key thing to note here, there really aren't any active ingredients within the Infuse It mask. What you'll do is it looks like a little multivitamin. You will put it in a bowl of cold water. Leave it in there for about 30 seconds. Then it will loosen up and you'll be able to unroll it and apply it into the skin. So this mask serves two purposes. One, it's going to help to draw out any sort of heat within the skin. But two, it's going to help to drive in whatever is underneath it a little bit deeper. So in the treatment room, if you wanted to drive in our hydrating facial treatment, what you'll do is you'll apply a layer of the daily dose of water, then you'll apply the Infuse It mask. And what the Infuse It mask is going to do is, one, pull out that heat within the skin, but also drive in that hyaluronic acid a little bit deeper. When you are putting this over any sort of mask, it's going to help to lock in the nutrients within the mask and also help it to absorb a little bit deeper within the skin. But the mask itself doesn't have the active ingredients other than its function is pulling out that heat. But what you put on underneath it, and then with that mask, it will take it to the next level. Enzyme exfoliation duos. Remember, exfoliating is important, but finding that balance of not over exfoliating. So we want to gently exfoliate the skin, especially with sensitive skin conditions. The Senzyme, just kind of how the name leads you to believe, it is a very, very sensitive fruit enzyme exfoliating treatment. So you have the papain, which is going to be your keratolytic enzyme that's going to digest digest those desmosomes. So think of it as little Pac-Men going in there and being able to digest that dead skin and allowing to soften the surface texture. Exfoliating, again, will help everything else that you're applying, the take it easy, your daily dose of water. It will all help those ingredients to be able to penetrate slightly deeper within the skin. So here the trick when using this in the treatment room is to apply the activating gel in the bowl first and then add the powder to it. By doing that, you are going to avoid that powder kind of puffing up into your face. But this is a very, very gentle exfoliator. Now, with enzymes, they are activated with the steam as well as with the gel. So to really get the maximum benefits and results with this enzyme exfoliation duo is you do want to apply steam. Now, with that said, if you have somebody who you apply steam at first and maybe they are still a little bit sensitive in that activity, try turning off the steam first before progressing and moving into removing the treatment itself. So if you remove the steam and that feels better, go ahead and continue to leave it on. So the exfoliation step is 10 minutes within there. So you want to leave it on up to 10 minutes, and then you'll remove it with warm towels. If that does not, if turning off the steam, they're still a little bit active, then go ahead and remove it prior to. So it's going to be up to 10 minutes, not necessarily have to be on there that full time. Protocol. So in the treatment room, we have a couple different options. So we do have a rosacea specific facial protocol. And you'll notice here that it does incorporate the Infuse It mask and daily dose of water along with Take It Easy. You do have the option to do an LED upgrade, which we'll talk about the different LEDs that you can use on sensitive skin, what's appropriate for sensitive skin. And then you'll make sure that you finish with your Ultra Skin Defense. So I know we didn't necessarily highlight it as a product, but sunscreen is extremely important when dealing with any skin type or skin condition, especially with sensitive skin, because the skin, with the barrier function being disrupted, it's not able to protect itself the way that healthy, stronger skin will. So sunscreen is a must. We also have a sensitive skin facial. So maybe somebody doesn't have rosacea, but they are just more on the sensitized or sensitive skin rosacea. With this, the finishing mask in this protocol is going to be the On the Mend. And again, you'll see that Infuse It added in there because of its capabilities of being able to calm and soothe and pull out any sort of heat and inflammation within the skin. You have the option of doing LED upgrades. So you have the red LED or blue LED, which you'll pair with a Rise and Shine mask. When pairing the LED with the Rise and Shine mask, just ensure that you are using applying a translucent layer. So it should be a very, very thin layer to the skin, so that way the light is able to absorb into the skin. If there's, they have sensitive skin, but they also want to target any sort of discoloration, the green LED would be your choice. And if they are highly inflamed, sensitized, sensitive skin, and their redness is really the main point of concern for them, then you'll want to use Take It Easy serum and pair it with a red LED light. Finishing it off with daily dose of water. You have the option of Call Me in the Morning or Feel Better. Apply easy on the eyes, and then ultimately finishing with the Ultimate Skin Defense SPF. Treatment modalities that are targeted for sensitive skin conditions. So we have the red LED light. The red LED light does calm and heal the skin. It will help to reduce inflammation, and it promotes healthy circulation. So it will help to repair and strengthen those capillary walls as well. Now, in the US, we do have the option of the amber LED. So the amber LED will soothe irritated or sensitized skin. It will help to reduce redness. It does calm some swelling as well as the inflammation in the skin, and it will decrease the look of visible blood vessels. For our Canadian partners, the red LED is very, very healing to the skin. So it does a phenomenal job as well as helping to treat any sort of sensitive skin conditions. When treating sensitive skin, so just kind of a reminder as far as the frequency of treatment. So we want to balance treating the skin, but not over treating the skin. So general rule of thumb, have your clients come in and the way that this is structured. So once a month or every 4 weeks is the perfect frequency for highly sensitive skin. All right, that concludes our webinar today on treating sensitive skin with confidence. I wanted to thank you guys for your time and continuing your education with ClarityRx. I hope you found the information valuable and helpful, and things that you can apply starting today in the treatment room when discussing with your sensitive skin clients how to best treat their skin concerns. If you have any additional questions, please do not hesitate to contact us at education@clarityclinicalskincare.com. Thanks a lot, and I hope you have a wonderful day.